Hey everybody, this is Dr. Chris Kelch from Avondale Health Center in Avondale, Arizona. Today we're going to talk about another type of headache. This information is straight from WebMD. If you want more information, please go to this website. But the type of headache in question we're going to talk about, thankfully you don't see very often. It's not very common, but they've been known to be so severe that they can actually cause people to commit suicide. They hurt that much. The headache in question is a headache called a cluster headache. So a cluster headache feels basically like an ice pick has been driven into your skull. Now what happens is there's a bundle of nerves called your Sphenopalatine Ganglion, or SPG. It points to this bundle of nerves right here. So what happens is this group of nerves gets overstimulated. And when it gets overstimulated, you get severe pain in the head. Now it can mimic migraine, it can mimic something called trigeminal neuralgia, so it's important to get the proper diagnosis. With this type of headache, it's important to probably get an MRI or a CT scan of the head too to make sure you don't have anything like a tumor going on. So once that's all ruled out, there's a way that we can treat that. There's something called an SPG nerve block. What an SPG nerve block is that it's a way that you can go in there and desensitize that bundle of nerves so that it's not as active. There's a very safe way to do it. I'm going to talk about that right now. So they used to go into here, remove part of your jaw and part of your face, and go in there and basically kill this part of your nerve. Well, that didn't work. So now, more recently, what they would do is put a Q-tip up each nostril, keep it there for 30 minutes, and hope that the medicine on the end of it would reach this bundle of nerves. Well, that doesn't work very well because a lot of times the medicine doesn't reach that bundle of nerves. And sometimes it's dangerous because it actually can puncture something called your cribriform plate, which can actually cause brain damage. So what happened was a couple years ago, this genius gentleman that we met, this medical doctor, developed a patented device that actually forms and fits very specifically into the nostril cavity here, and it sprays the medicine directly onto that bundle of nerves. So it allows you to use less medication than you would otherwise. It's more effective, and it works awesome. Our patients who get this treatment for migraine headaches might not have headaches for up to 6 months if they follow our protocol. So it works very, very well. So what we're going to do here at the end of this video is I'm going to show you a demonstration of how this works, show you how easy it is, show you how safe it is. And if you have any questions or want any more information on this procedure, if you have cluster headaches, feel free to look at the end of the video and go to our webpage. On that webpage, we have a free consultation coupon for you to come into our clinic. Basically, if you come into our clinic, we help determine exactly what kind of headache you're having, and then we can kind of go from there. So thanks for watching. So what we've got here is Avalon is getting the medicine ready. The medicine is just a local numbing agent helping to desensitize the nerve. So she's putting it in his nostril. She puts a little pressure on the plunger. The medicine goes in. She's done with that side already. He blows his nose. That gets the medicine moving more. She's getting the medicine ready for the other nostril. She go ahead and put that into the other nostril. That will numb that area as well. And boom, she's done.